Namaste. I'm Dr. Jaya Daptardar. I'm Ayurvedic doctor, healthcare executive, speaker, writer, licensed esthetician. So today I'm here to talk about Ayurveda's wisdom for addiction, alcohol addiction. Let me bring the presentation up here. So let's share the screen. Okay. So Ayurveda for alcohol addiction. First, I have a disclaimer. The sole purpose of this presentation is to provide an educational information about Ayurveda. This information is not intended for use of treatment, cure of disease. If you have any serious acute or chronic health concerns, please consult your family physician or healthcare provider who can fully assess your individual needs and provide the care you require. So, what is addiction? Definition of addiction: a compulsive need to use a habit forming substance that can be anything, characterized by tolerance and by well defined physiological symptoms upon withdrawal. Addiction is generally a neuropsychological symptom defining pervasive and intense urge to engage in maladaptive behaviors, providing immediate sensory rewards despite their harmful consequences. Dependence is generally an addiction that can involve withdrawal issues. Addiction is a disease. It affects brain functions, motivation, memory, and related activities. Addiction affects brain reward structure. Ayurveda calls addiction an intoxication. So, what are the causes of addiction? Genetic factors. It's genetic in some people. Environmental factors, like the people live in the environment where the drinking happens, and the culture. In some cultures, it's a tradition. Cognitive and affective distortions, which impair perceptions and compromise the ability to deal with feelings, resulting in significant self deception. So, in some cases, and maybe majority of cases, the mental or behavioral problems are involved. Disruption of healthy social supports and relationship problems. So sometimes the people are very emotional and cannot tolerate that they have no support or have multiple problems. A repeated engagement in the use of drug, prescription pain medication, or engagement in addictive behaviors, some kind of addictive engagement in some kind of addictive behaviors. Approach to pain relief. So sometimes people drink alcohol because they have pain and it kind of subsides the pain. and then it becomes addiction. Addiction, according to Ayurveda. In Ayurveda, it's called Madhya, and it's defined as Madhyatyānena karane yat Madhya, which does the action of Madha, is called Madhya. The term alcohol originally referred to the primary alcohol ethyl alcohol, the predominant alcohol in alcoholic beverages. It is classed as a central nervous system depressant. Madenattayo madattayaha. That means ati seven of madhya is madatte. So standard alcohol contains in different alcohol beverages. Just for your information, for BAC levels, this knowledge is important. Qualities of alcohol versus ojas. So this is also important. If you look at the qualities, it's worst in alcohol than ojas, right? So it kills the ojas in the body. So alcohol is Laghu, ojas is Guru, alcohol is Ushna, ojas is Shita, cooling, alcohol is Amla, ojas is Madhura, alcohol is Tikshna, ojas is Mridu, alcohol is Ashuga, and ojas is Prasanna. Alcohol is Ruksha, ojas is Tikshna. Ojas is Snigdha. Alcohol is Vyavahi versus ojas is Thira. Alcohol is Vikasi versus ojas is Shalashna. Alcohol is Vishada versus ojas is Pichal. So an average of 6 people die of alcohol poisoning each day in the United States. So this statistics is from National Center for Health Statistics mortality. And this is old statistics, but it's not changed much. Alcohol poisoning deaths are most common among middle-aged adults. If you look at the statistics here, the this bar here for ages 45 to 54 is 34%. And then here, women versus men, 76% men and 24% women. So most people who die of alcohol poisoning are men. Most people who die of alcohol poisoning are non-Hispanic whites. If you look at the bar here, the white non-Hispanics are 68%. And then there is the colorful map of United States, of all states, the dates by state per million people, and the dark brown color is more or the high, it's a higher rate. So do we need wellness approach to help people with addiction? Definitely we do. So if you look at this, let me see if I can scroll this more. But anyways, the stages of addiction, the first stage, second stage, third stage, and fourth stage. So how it affects, what are the BAC levels, and uh, what are the expressions, and then strotas involved. So first, when people drink, they feel like happy, relaxed, promotes like good sleep. The BAC level of it all depends how much alcohol is consumed, of course, but it is 25 to 100 mg percentage. So, and then it gives excitement. Manova srotas is involved. The second, impaired speech, vision. The second stage, in second stage, thought process is inappropriate, and then the activities are inappropriate as well. 100 to 200 mg percent, the BAC level. Excitement happens in this, but then there is a confusion. Manova srotas is involved, but Diva srotas, Chetanava srotas is involved. Third is lack of self-control. 200 to 300 mg percent is the BAC level. And slurred speech, confusion is involved in coordination. Sanjanavaha, the Spruti Strotas is involved. Chetanava Strotas is involved. And then in the fourth stage, hypothermia, cold sweat, unconsciousness, 300 mg percent, more than 300 mg percentage of BAC level, respiratory distress, coma, and maybe death if it is overdosed, and tolerance level is too low. Sanjanavaha, Strotas, Chetanava, Strotas are involved. So it's physically and mentally affected slowly from first stage to fourth stage. Doshas, involvement. Three doshas, all three doshas are involved. It's just not visible here, but dhatus, rasadi dhatus, especially rasa and rakta dhatus are involved. Manasik doshas, rajas and tamas are involved. Srotasas, manova srotas, we have just seen that. Rasadi, sarva srotas are involved. Sattva, ahara vihara is all fully messed up. In some cases, people don't get hungry, digestion issues are there. Moolasthana hridaya, because they don't think if it is good or bad for them. Then doshas involved and symptoms according to doshas. And then the sabrapti is, so how it happens. In Vataja dosha, Vatajanya addiction indulges in shoka, bhaya, heavy work, alcohol, which is ruksha, leads to impairment of sleep. And then the symptoms, hika, shwasa, pain, shula, pradyahara, like they don't think what needs to be done, more anxiety. Pittaja dosha involved food intake, which is trikshna, ushna, having madhya, which is Tikshna. That means food intake is also spicy, and then having alcohol on top of it, and which is amla too, sour too. Then the symptoms of pittaja alcoholic addiction is trishna, daha, jwara, sweda, sweat, murcha, sometimes unconsciousness, atisara, diarrhea, and brahma. So it's involved the involvement, if you can say, it's mental and physical level both. Kafajanya, intake of madhura. If, you know, that happens when people eat more sweet and heavy food, not doing more exercise, more day sleep, and then consumes alcohol. What happens is chardi, uh, you know, aro chaka, tandri. So these people, they lose the taste of, of the food. Aruchi is there. Tandri, they don't get engaged in anything. It's all heaviness in body and in mind, and have chills. Sannipatajanya, when all the three doshas are involved, what happens, how this happens is mixed nidana of three doshas. Already three doshas are affected, and affects like a slow poison when these people drink alcohol and drink too much. So mixed signs you will see, and mixed signs and symptoms you will see may cause death if overdose or leads to disease. So long-term effects of alcohol, and it's, if you can see, it affects all the organs of the body and mind both. Nervous system, tingling and loss of sensation in hands and feet. Blood, changes in red blood cells. Brain injury, loss of memory, uh, confusion, hallucinations, stomach level inflamed lining. So some people have hyperacidity, mandagni, the digestive system is all messed up, and due to acidity and drinking alcohol, not stopping drinking alcohol leads into ulcers and bleeding. Pancreas inflamed, pancreas causing pain. Intestines inflamed, the linings and ulcer. Muscle weakness, loss of muscle tissue. Skin is sweating all the time, bruising and flushings. Heart level, it's high blood pressure, irregular pulse, enlarged heart sometimes. Lungs, greater chance of infections in lung, including tuberculosis in some rare cases. Liver, several swelling and pain, because liver gets affected first due to alcohol poisoning. And then the hepatitis, it develops hepatitis, cirrhosis of liver, and maybe cancer. Sexual organs get affected. In males, impotence, shrinking of testicles, damaged or less sperm quantity. In females, greater risk of gynecological problems, damage to fetus if pregnant. So the complications of alcohol, of course, fetal alcohol syndrome, alcohol, liver disorders, fatty liver, alcohol hepatitis, alcoholic cirrhosis, ascites, jalodhar in Ayurveda. Uh, so this is Wernicke's encephalopathy. That is because of the vitamin B1 deficiency. Um, Korsakoff syndrome, alcohol-induced psychosis, which is Vishaja Unmad in Ayurveda, cancer of liver. So these are the three stages of evaluation. What happens when the patient comes to you with alcohol addiction? The first thing is the screening, complete screening. If the client is really um, drinking uh, alcohol and getting addicted or not. And when you find out this is the addiction, then the complete assessment is required, which involves the social history and biopsychosocial evaluation of the client, um, and then need to find out the client's willingness and uh, give him more motivation for the engagement in the treatment, and that only happens if the client is engaged and motivated. And then the treatment planning in Ayurveda. So these stages are very important in evaluating the addiction client. Three stages of alcohol addiction. One is the intoxication, the second is the withdrawal, and the third is dependence, and maybe fourth is the prevention from relapse. So, intoxication, Ayurvedic management. So, first thing in intoxication is detoxifying the body, but you cannot do a rigorous panchakarma. It all depends, it's all individualized, and it all depends upon the level of intoxication and how old this addiction is. Are there any relapses? The previous relapses and all these things are very important. And it has to be done very carefully to these patients, because you have to, at the same time, you have to think about the withdrawal management and then the dependence management as well. So the I mean, detoxifying body is a really good treatment plan in Ayurveda, uh, and it works uh, as a rejuvenating tool, and it strengthens the immune system, restoring balance and well-being. It is one of the most effective healing modalities in Ayurveda. Mind, body, and spirit balance is involved in the whole panchakarma process. It is different than just the cleansing. We say cleansing. It's not. It's a whole panchakarma. Five types of karmas are involved. Uh, Anxiety is always associated with increased bowel frequency in some cases. So you have to be careful when you give enema and purgatives. And then depression tend to be on the opposite side. When the client has more depression, they're more constipated. So they need more the purgation and enema and all these things. So to be mindful of that. Emesis woman is the better way to start in these cases, because they're consumed alcohol, it's in the stomach, and then with the emesis you can take it out before it starts affecting the brain and the physical body. mood has effect on intestinal motor function too, because these people have not the physical srotas involved, but the manoho srotas is also involved in this, and um, they have mood disorders. So you have to be mindful because it affects the intestinal motor function. Accumulation of toxins, that's ama if in old cases, chronic cases, in intestine created toxic substances in the body as well. The trauma and gut interaction between the stressful conditions, you have to be mindful. The result in it results in, so the whole thing, the intoxication and their previous trauma um, and stress, it all results in bad digestion, and it affects the intestinal function. So you have to be mindful while giving the panchakarma. Withdrawal management in Ayurveda. So after the MSS, like I said, it is more important to give Vamana, the purgation virechana, if the client is eligible and you think this is a good idea. Most of the cases when the client have depression, it's good. It's good to do enema. Nourishing treatment is recommended. Santarpana Janya Chikitsa in Ayurveda, digestive herbs or juices are recommended. Lemon juice with herbs and rock salts, Abhyanga, Shirodhara, uh, Takradhara is recommended in these cases because it's a lot of daha is involved. Pomegranate or grape juice and dates are recommended as anti-craving because in withdrawal management, this is also important. In some cases, it is also important uh, that uh, slowly restrict the alcohol intake and not completely stop. So in many cases, it's required to uh, to include something which tastes like alcohol for them. Um, so the beverages, maybe it's including soda. It's not healthy, but it is required because to manage their withdrawal symptoms. And then Sattva Chikitsa in Ayurveda for restricting the use of alcohol. So, increasing sattva in their body by giving good sattvic ahar, managing lifestyle management. This is not easy. And we'll see in the next slide that for the dependence treatment, the say no to alcohol, it's easy to say, but in these cases, you have to make sure to motivate your clients to do this, to increase the sattva in their mind. The more cleansing of mind is needed. So that's where the yoga and meditation comes in. I have uh, slides, the next slides included in this. Use of or supporting mind health and good digestion and good sleep is important. Psychotherapy, cognitive behavior therapy, and individual and group therapy is required for this. Ayurvedic wisdom for alcohol addiction. Ayurveda offers a lot of good herbs for digestion, for mind health, and improve immunity and ojas and all that. So soothing food and dependence management. So soothing food is important in dependence management, like I said, to improve sattva in the body, khichdi, a lot of juices like grapefruit, pomegranate, gooseberries are good for withdrawal and dependence management. Lemon ginger tea, continuously drinking the lemon ginger tea. Recipes made from whole wheat or whole grains, black beans, more protein, high protein. It's important to manage the uh, nutrients in the body. Black dates are good. Black raisins are very good. Tamarind is found to be effective in management of addiction of alcohol. Herbal remedies, strengthening nervous system is Brahmi. Then for memory and concentration, go to Kola. Immunity and nervine tonic, ashwagandha, whole basil, moringa is recommended to lessen cravings. Gurumar, neem, and turmeric works. Ayurvedic psychotherapy, herbs, cardamom, nutmeg, saffron, bacopa, digestive herbs to increase metabolism, ginger, black pepper, turmeric, tricketu, whole basil, holy basil. Constipation and continuous cleansing is required, so triphala is good for that. Herbs by its effect. Um, and yoga therapy for relapse prevention and recovery is recommended. The different yoga poses are recommended, but any yoga is good. Breathing exercises, pranayama for relapse prevention and recovery. The pranayama works the best, and I have experienced that in my clients because we need extra oxygen for rejuvenating the cells. Deep breathing is important to focus. Aromatherapy is good. Abdominal breathing, deep breathing is good for anxiety and depression levels. So, and this transforms the thoughts as well. Meditation is a very, very good tool. If they can do, it's hard for them to do because of the, you know, mono is involved. But guided meditation and music is the meditation for them. Energy healing, of course, aromatherapy is good. And the conclusion is Ayurvedic Panchakarma helps in drug addiction or the alcohol addiction to recover from it. We can integrate both therapies together slowly, but it's more effective and long term. They follow up with the Ayurvedic lifestyle management, seasonal cleansing, and continuous practice of yoga meditation. Stay away from drugs and alcohol and related parties and restaurant foods and trends and all that. Follow Ayurvedic food according to the dosha and season. And here are my books: Eating Gracefully, Be Beautiful Inside Out, and mainly the Ayurveda's wisdom for management of pain and addiction. And then these are the resources, references. And thank you. My book for reference is Ayurveda's Wisdom for Pain Management and Addiction. Thank you very much for listening.